Hi everyone, welcome back to my channel. Let's talk about pancreatitis. Pancreatitis occurs in the pancreas when there is issue in the pancreas. This condition, the patient that had this condition has a severe pain, upper left quadrant pain. You see these two signs of pain, calling and tonal sign, occur on the periumbilical, while the tonal sign occur at the flank area. Nclex is gonna test your knowledge based on this type of pain. A patient that has pancreatitis has severe pain. They have severe pain, abdominal pain, back pain. That is why a patient that is having pancreatitis feel comfortable at the fetal position. This is Nclex question. Place the patient in a fetal position. Do not place the patient in a spine position. This is Nclex question. Nclex tip. They're gonna ask you the position. Maybe they will give you a scenario based on a patient is having pancreatitis. What position will you put the patient? What position will you place the patient? They're gonna list spine position, prone position, whatever position, and fetal position. Please select the option that says fetal position. The patient always feel comfortable in a fetal position. A patient that has pancreatitis, they always dehydrated. You know, it's MPO. MPO, nothing per mouth, because we need to rest the intestine, the stomach. You don't need to cause more trouble to a patient that has pancreatitis. That's why they are on MPO or TPN. TPN, MPO. So what they needed is food to rehydrate them. Continuous food to rehydrate them. Nothing per mouth. This is Nclex question. This is Nclex tips. MPO. A patient that has pancreatitis, they cannot digest fat, so cut down fats. Cut down fats. They don't need fat in their meal. Okay, I hope you guys are getting me. I hope you guys are understanding me. This is Nclex tip. And do you know the medication? Pain medication, you know, they have severe pain. They always on pain. Do not give them morphine. This is Nclex question. Do not give them morphine. Morphine is contraindicated in a patient that has pancreatitis. Yeah. Morphine is contraindicated because it causes spasm in the sphincter of OD. This is Nclex question. Let me say that again. This is Nclex tips. For a patient that has pancreatitis, do not give morphine as pain medication. In Nclex, they will ask you, what kind of medication will you give to a patient that has pancreatitis? They're gonna list all those opium medication, all those narcotic medication. Please do not give morphine. Morphine is contraindicated in a patient that has pancreatitis, because when you give morphine, you will make it worse. When you give morphine, it will cause spasm in the sphincter of OD. You will make it worse when you give morphine. This is very important. Nclex, they will test your knowledge based on medication. They're gonna test your knowledge. One of my students that take Nclex last 2 months, they asked her about the medication. What medication is contraindicated in a patient that has pancreatitis? They list all those opioid narcotic medication, including morphine. So, if you know that morphine is contraindicated, you are not gonna make any mistake in selecting your option. That is why you need to pay attention. You need to know what pancreatitis is all about, the medication, the treatment, for you to be able to answer any question that concerns pancreatitis. Nclex tip. Remember, the position is fetal position, no spine position, no prone position, just fetal position. And again, a patient that has chronic pancreatitis, they give enzyme. Nclex will ask you, how did they give the enzyme? You give with meal. Give with meal. They will ask you, giving enzymes in a patient that has pancreatitis, is it on empty stomach? Is it after meal? Is it before meal? You give with meal. Give with food. Give with food. This is Nclex tip. This is very important. You need to pay attention. And please don't forget to share this information. So many people out there are waiting for this information. Guys, in a patient that has pancreatitis, you need to test glucose level regularly, blood glucose level, to know if the insulin is increasing or not. You need to test blood glucose level. One of my students told me that when she was taking her own exam, she come across this blood glucose level of 18 I'm talking about now. They asked her, what assessment will you do in a patient that has pancreatitis? They listed all the testing of 18. They listed all the labs, and she selected blood glucose level, which is correct. Guys, Nclex can never confuse you. The only thing we need to do when answering Nclex question is paying attention to the modifiable phrase. Pay attention to the keywords. Pay attention to the key points. Pay attention to the scenario. Pay attention to the last sentence of each question, so that you can be able to select your correct option. Remember that knowing your content is the ultimate goal for you to pass your exam. Knowing your content is the key for you to pass your exam. Yes. Try to know the fundamental. Try to know the foundation of Nclex before you go into question and answer. Remember, you can, you will, and you must pass your Nclex exam. I wish you all the best. Awareness is the key. Do not get it twisted. See you guys in my next video. Share this information out. Thank you so much. I love you all. Bye.